Welcome to Medical Dialogues. I'm Roshni. Let's look at today's top news. Government bans pharma firms, gifts and travel sponsorship for doctors. The government has taken a significant step by implementing a uniform code for marketing practices in the pharmaceutical industry. This move aims to address concerns regarding unethical practices such as providing travel and stay facilities to doctors and their families, offering gifts, and distributing free drug samples. By prohibiting these activities, the government intends to ensure that healthcare decisions are based on professional judgment rather than influenced by incentives from pharmaceutical companies. The enforcement of the Uniform Code for Pharmaceutical Marketing Practices, or UCPMP 2024, marks a shift towards greater transparency and accountability in the industry. By holding pharmaceutical companies responsible for adhering to the code, particularly through the accountability of CEOs, the government emphasizes the importance of ethical conduct in the pharmaceutical industry. Already an expensive affair, cancer treatment becomes even more burdensome when unscrupulous individuals exploit vulnerable patients. By selling counterfeit medications, in a recent crackdown, Delhi police apprehended 7 individuals, including 2 hospital employees, for their involvement in a counterfeit drug racket. These perpetrators repackaged cheap antifungal drugs valued at just Rs 200 into empty vials, which they deceitfully marketed as life-saving cancer treatments, fetching prices ranging from Rs 1 to 3 lakh per vial. This illicit operation, which spanned over 2 years, saw the distribution of over 7,000 injections. The mastermind, Vipul Jain, oversaw the manufacturing process in flats located in Moti Nagar, with Suraj Shat managing the illicit filing of drug vials. Neeraj Chauhan stockpiled the counterfeit drugs in Gurugram, aided by compliances including Tushar, a lab technician, and Parvez, a former pharmacist. Additionally, Komal Tiwari and Abhinay Kohli, employees at a Delhi hospital, facilitated the supply of empty vials. The police have initiated legal action against the group for drug adulteration, fraud, and conspiracy. India receives award for exemplary efforts in measles and rubella disease prevention. India's receipt of the Measles and Rubella Champion Award highlights its effective efforts in combating these diseases, particularly among children. Ambassador Sri Priya Ranganathan, Deputy Chief of Mission and the Embassy of India, accepted the award on behalf of the Ministry of Health and Family Welfare. The Measles and Rubella Partnership recognized India's leadership in reducing measles and rubella cases, attributed to proactive vaccination campaigns, innovative strategies for reaching underserved populations, and robust surveillance system. The award underscores the dedication of frontline health workers, healthcare professionals, and communities nationwide. The Supreme Court recently ruled that while a report by the Medical Council is relevant in cases of medical negligence, it cannot be conclusive to contradict factual findings by a consumer forum. The case involved alleged negligence by an ophthalmologist and a clinic in Bardhaman, West Bengal, resulting in a 13-year-old losing vision in his right eye post-cataract surgery. Initially, the District Consumer Court awarded compensation, but the State Commission overturned this decision based on the Medical Council's report. The Supreme Court emphasized that forums must thoroughly examine evidence before relying solely on such reports. Despite Medical Council findings favoring the doctor, the court noted unchallenged evidence of negligence. It criticized the lower courts for neglecting the evidence and blindly relying on the Medical Council's report. The Supreme Court upheld the District Consumer Court's decision, affirming negligence by the doctor and the clinic, and it ordered compliance with the initial compensation ruling, underscoring the duty of care extending beyond surgery. The Central Administrative Tribunal has halted the recent appointment of Professor Dr. Surjit Singh as the Dean of Academics at the PGIMER, Chandigarh. The CAT directed the PGIMER director not to accept Dr. Singh's joining report until the next hearing on 8th of April. Dr. Naresh Panda, the senior professor, challenged Dr. Singh's appointment, arguing his higher seniority made him more suitable for the position. The CAT observed that Dr. Panda had presented a prima facie case warranting the interim direction to halt Dr. Singh's appointment. Allegations against Dr. Surjit Singh by 7 female professors led the administration to exclude his name from the panel list. However, the ministry notified his appointment despite his exclusion from the panel submitted by the institute. Further clarity on the matter is expected as the case progresses in the CAT. The NMC has announced the elimination of physical inspections in medical colleges, aiming to eradicate Inspector Raj and enhance transparency. Utilizing the AEBAS portal, the NMC will rely on digital data to access faculty attendance, reducing manual interference and ensuring authenticity. This shift to a digitally driven approach will streamline inspections with data from the AEBS portal, replacing traditional methods. Surprise inspections will continue focusing on verifying data and accessing physical infrastructure. Furthermore, the NMC will launch an online portal for medical college to appeal compliance-related issues, facilitating a more streamlined process. To address concerns regarding gross faculty, the NMC issued guidelines prohibiting private practice during college hours. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.